Good morning, my loves. Happy Sunday. It is a very rainy day here at the lake. It has been raining since Friday. The water here, it is, you can't tell, I don't think you can tell, but it is probably a foot this way from the edge of the bank up onto the dirt, onto the grass. And I would say it's probably 6 inches deep, so the water is rising. But it's a steep embankment, so I'm fine. And I'm on the second floor, so there's nothing to worry about. I hear traffic going past so that the roads are passable at this time, so everything's okay. You just have to grin and bear it. Such is life. For those that know, October is Breast Cancer Awareness Month, and that's what we're talking about today. Many of you have already known about my breast cancer. You've heard my breast cancer story. I'm going to share it again. Please, please share it. Please. It could save somebody's life. And I have to say, everyone's cancer journey is different. It is unique and it is yours. When somebody is diagnosed with cancer, do not start saying, well, I knew somebody who had that kind of cancer or who was on that kind of chemo and this happened to them and that happened. Don't try and scare people. This is their journey. It's your journey if it's you. It's an individual thing. I had people doing that to me. And it's like, and I'm a nurse. It's like, seriously? Hey, I'm a nurse. I know. I also took care of my mom when she had cancer. And people would tell her that. And it was just, initially it kind of scared her and upset her, and then it just kind of pissed her off. And she would tell them, well, that's your story. That's what happened to you. But this is mine. And a lot of dealing with cancer, my opinion, is perspective. And I remember the first time I had breast cancer back in the 1990s, my Uncle Joe, one of the coolest guys on the planet, he sat me down and he said, Gal, he was a Texan through and through. He said, Gal, you can have the bear or the bear can have you. You can have cancer or cancer can have you. It's up to you. You get in there and you fight it. Okay. And he was right. So much, my opinion, of dealing with a terminal illness, with dealing with cancer, with dealing with anything in life is your perspective. You can have it or it can have you. You can have heart disease can have you. You can have cancer can have you. You can have the bear can have you. It's up to you. Who's going to win? Who's going to fight? Who's going to have the upper hand? And some days it's quite a battle. But it's your choice. I want you to fight it. I fought it. If I can do it, so can you. Now, it was 2014, February. I go every year for my annual exam. I'm good friends with my gynecologist. And I went in, had my exam. He said, you need to get your MAMS. I know. It's just, work is really busy. We're in trial. And I was a nurse, of course, at a medical malpractice law firm in St. Louis. And we were really, really busy in a trial. And I said, I promise I will. I just can't now. He said, you've said that for 3 years. You've got to do this. I said, I know, but I was in the middle of a divorce. I said, between the divorce and work, and my dad was dying. And he said, I know. Okay, you get dressed. We'll talk. Okay. So I got dressed, and he comes in, peeks his head around the door, and he goes, I have a surprise for you. Tell me. Do tell. And he took me by the hand, and he walked me down to the mammogram center. Yeah. I owe him for that. He saved my life. They did the mammogram. I go back to work. It's not that big a deal. It takes 15, 20 minutes to get smushed. Now, I know, as having breast cancer before, they're going to find something. They're going to find a lump. I had very small breasts at the time and very dense breast tissue, very hard to see. They always find something. Not that big a deal. And in all likelihood, they're going to call me back and say, oh, you need to come in for an ultrasound, and we're going to do a needle biopsy. Again, it takes 20 minutes. It's just inconvenient, not that big a deal. Got back to work, got the phone call. We need to do the ultrasound and the needle biopsy. Fine, set it up, whatever. It's not that big a deal. It didn't surprise me at all. I go, I have the needle biopsy and all of that. The following week, go back to work. And Shannon, my gynecologist, calls. And he said, Hey, it's me. I said, and let me guess. We need to do another one. They need to, there's a problem with the imaging. What is it this time? And he said, you have cancer. And you need to see the oncologist this time. Okay. He said, I think I want you to go to BJC, Barnes Jewish. He said they're very cutting edge. Okay. I went. First, I called my bestie, of course. I have 6 besties. So I called my bestest friend, Gary. Now, Gary has multiple myeloma. And when Gary was diagnosed in 2011, I was one of the first people that he called. When he went for stem cell transplant, and he lives in Pennsylvania, he called me and he said, need a fave. Ask. I need you to come take care of me during stem cell transplant in the hospital and be my caregiver in the hospital. You'll be here for probably 2 months. Done. I will do that for a friend. Absolutely, positively, I will do that for a friend. And I did. So when I called and I told him, he said, let me know when the appointment is. I will fly in to go with you to your first oncology appointment. And he did. And he flew out the same night. But that's the relationship I have with my best friends. We're like that with each other. We have each other's backs, regardless, no matter what, we are there for each other. And so he went with me to the appointment. They started me on chemo. May or may not lose my hair, may or may not be violently ill, the usual things to tell you. Okay, fine. Again, I can have the bear can have me. So we start. I would take my Zofran at 3 o'clock at work. I got off at 3 at the law firm, leave work, go have my treatment. Some idiot is out on the lake in a canoe. People, go figure. Anyway, I would go get my chemo, come home, be sick all night. That's how it works. And then you get up and you go to work the next day. I never missed one day of work on chemo because I couldn't. I had to depend on me. I had nobody else. My family was in Kansas. I'm in St. Louis. My dad, who was dying, was in the Ozarks. Now, everybody in the family, rightfully so, please understand this. My dad, beautiful man, he died the following year, but his days were very numbered. And the focus should have been on Daddy. I will manage. Y'all take care of Daddy. And they did. So my besties took care of me. They had my back. And so I had Gary. I had 2 Garys, and that were wonderful. Lynn, Lisa, Clay, amazing people. They had my back every step of the way. I could not have done it without them. I'm getting ready to sneeze. No, I'm not. Am I? No. Okay. Oh, now my eyes are watering. Oh my gosh. This weather here is just driving me nuts. So the chemo was going relatively well. I'm working. The divorce was over, thank God. My hair was starting to fall out. It's an issue. I would go down to see my dad when I could. It's a 3-hour drive from St. Louis down to the Ozarks. Okay. And one day I went, and yes, my hair was falling out. It was a little bit longer than it is now. Similar cut, and I looked a little younger 10 years ago. And I would go down to see them, and he was always so happy to see me. And I just adored my dad. He was one of the finest men God ever put on this earth. And I would always take him some treats from St. Louis, some barbecue chicken or something special. He loved barbecue. Something special from St. Louis. And I took it down, and we're sitting there, and his second wife, my mom had passed and Daddy remarried, came over and sat down next to me on the love seat. Now, she is from the Ozarks, and she is by no means a cultured individual. And she said, you got you a bald spot. You got you a big old bald spot. Joe, do you know she has her bald spot? Look at this bald spot. And she just yanked my head down. Don't do that to people. Do not do that to people. Do not embarrass them. Do not humiliate them. Don't do that. And she had been around people that had cancer, but she's just simple. We're just going to leave it like that. And she wouldn't let it go. And she said, look, I can just pull her hair plumb out of her head. Don't do that. Do not do that. And my dad, God bless him, would say, just leave her alone. Just leave her alone. She'll be okay. Why don't you go get her another cup of coffee? And after about an hour, hour and a half of this, I couldn't take it anymore. Got up and I went over and I gave Daddy a hug. And I said, I'm not spending the weekend. I'm going home. I think we both know why. And he said, Bren, I'm awful sorry. Well, she just didn't understand why. Look at that. Look at your hair coming out. I'll have to vacuum now. Great. I left, got in the car, and I'm driving home crying. And I called Bethany, who did my hair in St. Louis, told her what was going on. She said, I will meet you at your house. It is time to shave your head. I had already bought my wigs, very expensive wigs, beautiful wigs. It looked just like my hair. And she said, don't worry, we'll get through this. And that's what we did. The next day, I wore my wigs to work. Some people were very complimentary. They knew what I was going through at the firm. One attorney was a total ass. And in the elevator, he looked at me and said, seriously? Why don't you just go bald? It looked better than that. It was a beautiful wig. It looked it looked nicer than my hair, actually. But the same color, same cut. He was just an ass. That was just the second of many asses that I would encounter during my chemo journey. But people are jerks, no matter what. It's just who they are. So I, was doing relatively well, wearing my wig. Wearing a wig isn't that bad. You wash it, you dry it, you hang it up. In the morning, it's like wash and wear clothes. It's perfect. You wash it once a week. My cats were in love with it. I had 2 cats at the time. They would find it and haul it all over the house. I would have to hide it. It was kind of cute. I had Gary's daughter sent me a Grace box, and Leanne sent it, and it just meant the world to me. And it was a candle and a little hat, a very, very soft felt hat, and some very nice things, that just made your heart smile. And a couple of times I would wear the hat to work instead of the wig if it was a real windy day or something. And I had to walk a couple of blocks from the parking garage to the office. So it was okay. People had my back. My friends were there for me. And I just love them to the moon and back. Best people on the planet. I made some new friends in chemo. There was a really cool guy that I met, Michael. He had lymphoma. He had cancer of the bladder and lymphoma. He was a Vietnam veteran. He was just a couple of years older than me. Really a neat guy. And we remained close friends. He died 3 years ago. He lost the battle. But he was a really cool guy. And we never dated. We were just chemo buddies. We until you go through chemo, you can't understand it. You can be there for people. You can try to appreciate and empathize. But until you're the one being poisoned by chemo, until you're the one throwing up and having the bone pain and all that goes with it, until it's you, it's hard to understand. It's like pregnancy. You can empathize with somebody who's pregnant, but until it's you, you don't get it. So he was my chemo buddy, for many, many years, even after. And, he, like I said, he passed about 3 years ago. He lost the fight. He gave up the fight. He quit treating. He was just done. And it was time. And you can't judge people if they decide to do chemo, if they decide not to do chemo, if they decide to stop chemo. It's their decision. Get off their back. It's their call. I did chemo. I've done chemo more than once. Would I do it again? I cannot answer that question right now because I don't know, honestly. Yes, I have a wonderful life to live. I have my granddaughter who I adore and my son, but that doesn't mean I want to spend 2 years sick and may not make it through chemo. During my chemo journey, once I started chemo, I went into congestive heart failure. I was at work one day and my shoes were tight. I was wearing kind of like little ballet slippers. And I looked down and my feet were balloons. Okay, this isn't good. So I called the oncologist who said, yeah, we got a problem. You need to see your cardiologist. Oh, great. Well, now I'm dealing with congestive heart failure. Great. So one of the other nurses in the law firm that I worked in, Sheila, came to my office and she said, you're an idiot. And I said, well, I love you too. Thank you. She said, no, what would you tell me if I was diagnosed with cancer? What's the first thing that comes to mind? And I said, get a second opinion. I hadn't. She said, pick up the phone. I did. Shannon set me up with someone at St. Luke's. Now, St. Luke's is the hospital I always went to. I love St. Luke's. He set me up with Patty, Dr. Patty. I will not mention her last name. I don't know if she's still working or she's retired. She was brilliant. And I went to see her. And she had all my records. And she said, first thing we need to do is a dense breast scan. They haven't done one. They need to do one. You have very dense breast tissue. I need to know what we're dealing with. They haven't done a PET scan. They haven't done all kinds of things they need to do. Let's get this done. Right then, in her office. We did. She called me back in the office. Now, let me back up. So when we're doing the scan, the breast dense scan, the tech called an interventional radiologist. That is the radiologist that does procedures. They will put in, they'll help with the thoracentesis sometime, or arterial lines, or if you have surgery on your knee or your shoulder, many times they'll assist or they'll do a procedure. So he called this doctor in, and very nice man, and introduced himself, shook my hand, and he said, have you talked to Patty? I said, initially, yes, I'll be seeing her again in a minute. And he said, I'm just telling you from my perspective, you need a double mastectomy. Do you know it's in both breasts? I said, I was told it was in one. He said, well, it's in both. And I'm calling Patty, but you really need to keep this in mind. That is not what I expected to hear that day. Okay. And I thanked him. Went back into the exam room, and Patty comes in. I will never forget. I'm sitting at the edge of the exam table, and she rolls the stool up, to me, and she puts her hands on both of my knees, and she says, the girls have got to go. Now. It's time. This isn't good. This isn't good at all. We're looking at stage 3 breast cancer. They put you on the wrong chemo. That's why it's now in both breasts. Let's get this taken care of. You're young, you're beautiful. I want you to have a beautiful life. And I said, okay. And she said, you're pausing. I said, well, just finish your sentence. She said, let's get you set up for surgery next month. I can't. I don't have time. Swear to God. I said, I don't have time. We're in trial at work because I work at a medical malpractice firm. And when you're in trial as the nurse, you are at trial every day because they're our experts, our client are on trial. They're on the stand. I have to be there to kibitz. And she just looked at me. And I said, and then after that, I'm going on vacation. And she just looked at me and she said, okay. Now, I don't know if she actually wrote this in a record, but she said it as she was acting like she wrote it. And she said, patient does not have time for surgery, for life-saving mastectomy. Patient will make time to die of breast cancer. Point taken. Touche. Said, okay, you made your point. When I come back from vacation, we'll do this. She said, yeah, I think vacation is good because you're going to need some downtime before you go into this because it's going to be a lot. Fine. She said, let's talk reconstruction. I said, we're not dealing with a lot here because I had very, very small breasts at the time. I said, I'm not really into it. Let's just let it go. And she said, no. You are a young, beautiful woman, and I want you to have the figure and the physique and the, how did she put it? She wanted me to have the figure and the physique of a young, beautiful woman and a healthy mindset to go with that. She said, dealing with cancer is a mind game. And it is. Again, you can have the bear can have you. And I said, right. And I told her, you can have the bear can have you. She said, exactly. I want you to talk to a reconstructive surgeon. I wasn't that interested, but fine, whatever. She set me up with an appointment with Sam Kababi. Now, I will use Sam's name because Sam is an absolutely brilliant plastic surgeon. And I just love, he and his wife are just, I love them. They're the best. I met with Sam. Gary flew in, again, went with me. He's a good bestie, I tell you. And we looked through the catalog that Sam called the Great Book of Boobs, and to try to find out what I wanted. And finally, I just closed the book and said, no, you are an artist. You are a reconstructive surgeon. You put on my body what you think is going to look best on me, not what I think will look best on me. Agreed. Okay. Went on vacation. I came back to work. Hang on. Let me just back up a minute. Tell you something that happened when we were on vacation. We went to Canada. We went to Niagara at the lake. And of course, if you're at Niagara on the lake, you're going to go to Niagara Falls. And I did not wear my wig when we visited the falls because the winds are just humongous. So I wore a ball cap. It looked really cute because I look pretty darn cute bald. I can pull off bald damn well, tell you that. So I had my makeup on, of course, and I had my little ball cap. And this jerk walks up to me, an older man, and he got pretty close to me, and he said, swear to God, are you one of them? What's a one of them? Are you one of them gay people? What? Are you one of them gay people? You shave your head because you're one of them gay people? I said, no, I'm one of them cancer people. I have breast cancer. Is that all right with you? He said, well, I just didn't want you to be one of them gay people. And his wife's coming up saying, oh, just don't pay any attention to him. He doesn't mean it. Wrong thing to say to me. I mean, I am nice and kind and sweet, but do not do that. I said, so you're saying, A, I am not gay, but you're saying you would rather somebody have cancer than be gay? Well, I said, no, just shut up a minute. It came out of your mouth. You would wish cancer upon gay people? Well, I'm not saying that. Yes, you are. Yes, you are. Do you realize you can have cancer? Do you realize your beautiful wife, and these people were in their 70s, your beautiful wife standing next to you could have cancer. Your kids, your grandkids could be diagnosed today with cancer. And you would rather have them have cancer, fighting for their lives, than have a different lifestyle than you like? Well, that's not what I'm saying. Well, yeah, it is. And you're an ass. You are a total and complete ass. And his wife was so apologetic, and he was apologizing. And he said, I'm really, really sorry. And I said, yeah, you are. You are a very sorry human being. You truly are. And I walked away. Gary thought I was going to hit him. But people are just jerks. You know, they're just cruel. They don't think. And it was hateful and it was hurtful. So, vacation went nice. It was okay. Get back. Go back to work for about a week. Time for surgery. Okay. We go in. Now, you got to remember, I've been a nurse. I got my nursing degree in 1979. I've been a nurse a long time. Back in the day, you were in the hospital a couple of days. Double mastectomy. Same-day surgery. Blew my mind. Went home that evening. Now, I am about as stubborn as they come. And Gary, God bless him, my bestie, rallied to my side. He flew in to take care of me for a couple of days because I didn't have anybody else. He was going to fly in and take care of me because I took care of him when he had stem cell. He's taking care of me post-op. Me and my 2 cats. Taking care of the cats was a hell of a lot easier than taking care of me. And, of course, he had backup. Lynn, Lisa, Clay were there. You know, he had some backup if he needed it. I put him through his paces. I tell you, we get home from the hospital, and I let nothing stop me. This is just me. When I am sick, I don't let it stop me. I have things to do. I don't do sick. I remember when I was little, my mom would say, you know, mommies can't get sick. You're not allowed to be sick. You have people to take care of. Well, nurses have people to take care of. I had things to do. I don't let anything stop me. To this day, I don't let anything stop me. I come home, and I will never forget, we walked in through the garage. I put my purse on the kitchen cabinet, and the cats were meowing. And I said, okay, I need to get the cats fed. Gary said, I'll feed the cats. I said, okay, I'm going to unload the dishwasher. He said, you just had surgery. And I said, look, there are things to do around here. He said, go lay down. I said, after I did unload the dishwasher. I did unload the dishwasher. And he's just shaking his head. I know he will see this video and start laughing because I am not a good patient, but I admit it. You know, anybody that knows me, you will know this. Now, I did something that is cardinal sin, unless you're a nurse or a doctor, and then you will get this. So I go in the bedroom, and I have bandages from, probably down here to up here. Yeah, they're itchy, they're uncomfortable, they gotta go. Seriously. He comes in the bedroom to check on me, and I'm peeling off bandages. And he says, what are you doing? I said, the bandages have got to go. He said, they put them on. I know they put them on. I was there. I'm taking them off. It's fine. And I remember peeling off the last big bandage and looking at myself. And I have seen countless cancer patients and surgical patients in my day. It's different when it's you. Imagine a chicken or a turkey after dinner, after the bones are picked clean, and you just have that carcass and with skin on it. And that's what I looked like. I had skin, I had bones. They had removed all the breast tissue. They had removed all the muscle. It was skin and bone. And it was bruised, of course. But it was, I can't put it into words. It was very humbling. It really was. And I started to cry, and Gary just held me. He let me cry. And, you know, I got it out of my system. I had no pain, none. Sam had told me when I left the hospital that you're not going to have any pain because you have a block, a nerve block. He said, now, and tomorrow, you know, you're going to wake up, and in a few hours you are going to have pain, but it's going to be short-lived. Here's a prescription for Flexeril, which is a muscle relaxant, and here's a prescription for pain meds. I don't think you're going to need the pain meds, but fill it if you need it. Take the Flexeril, the muscle relaxant, twice a day, and that's just because of all the work we had to do to the rib cage, peeling off, you know, all the muscle and all the tissue and everything. He said it's going to be sore, really, really sore. So just know that. Okay, I can deal with that. I never had the prescription for pain meds filled, I don't think, but I did take the Flexeril. And I did not lay around in bed, which drove Gary crazy. I had drains that we had to tend to. We had to empty the drains and keep track of how much drainage there was. There really wasn't that much. And Gary was there for like 3 days, and it was time for him to go home. And I'm trying to remember, he must have called a cab. I'm trying to think. It's been a long time. I know I didn't drive him to the airport. I couldn't drive yet. I guess he must have called a cab. We didn't, or an Uber or something. And he had his bags in the living room. And we were waiting on it to get there. And he said, what are you doing? And I was going over to the closet. And he said, you're not going with me. I said, no, I'm getting the vacuum. No. And he put it away. I said, I need to vacuum. We have cats. There's cat hair. And he said, okay, knock yourself out. You do that. I want to see you vacuum. I plug it in. I turn it on. I didn't have the capacity to push the vacuum. He took it out of my hand and he put it away. And he said, sit your butt down, have a cup of tea, and behave yourself. His cab came, he kissed me on the forehead, and he left. So I had tissue expanders in. Tissue expanders, because I had such small breasts, and the implants I was getting, I am considerably larger now. The implants had to stretch the skin. The tissue expanders are like balloons, flat balloons. So I would go in to see Sam every week, and he would insert saline to stretch the tissue expander and to stretch my skin so that it could accommodate the new implant. We went through this for several weeks. It did not hurt. Now, this is my case. In my case, it did not hurt. I had no pain at all. I might be a little sore, maybe just a little bit, but it didn't hurt because all I had was skin and bone under there. I didn't have anything to hurt. So I never had an issue. I know many women Many women have horrific pain with tissue expanders, to the point some of them will say, no, I don't want to do this anymore. Take it out. I don't want the implant. That's their story. That's them. Do not judge. Don't judge somebody on their cancer journey. It's their journey, not yours. I didn't have an issue. So after several trips, getting inflated, and that's what they call it, you're getting inflated, I was of the appropriate size. We scheduled surgery again. Went in, switched them out. That was it. They look nice. They've held up. My weight has gone up and down a little bit. I probably lost, I'm trying to think. In 2014, I want to say I weighed probably 145, and now I weigh 130. So, my weight's varied maybe 10 pounds, which will affect your skin and how they hold up around the implant. But I look fine. I go for my mammogram every year. And I know I don't have breast tissue, but tissue does regenerate, and so do cancer cells. I go every year for a mammogram. Absolutely. I'm going this coming Tuesday, for a bone density test, because chemo will deplete your bones. It will suck the life right out of your bones. You just got to be careful. You got to take care of yourself. A mammogram is self-care. A bone density test is self-care. Blood work is self-care. Seeing the doctor is self-care. Going to every cancer appointment is self-care. Having a double mastectomy is self-care. I do want to say, when I went to see Patty, she told me I needed the double mastectomy. When I'd been in the waiting room, there was a family in there, and you kind of visit with people, and this young woman was just lovely, and it was her husband, and her daughter. Her daughter was probably 7. Just lovely people. And she has a very aggressive breast cancer, and she's been fighting it a long time. And she said, if I find out that the biopsy results say it's back, I'm done. I can't do it anymore. We can't do it anymore. I'm just going to let it go. Okay. I said, well, I'm going to keep you in my prayers. And she said, thank you. And I got called back, to see Patty, and that was the end of it. So I left Patty's office, and I go to the car, and I'm crying. I did not expect to hear, you're going to need a double mastectomy. So I'm sitting in my car. I don't want to say it was a pity party, because it wasn't. It was just traumatic news that I'm processing. I expected, you're going to be on chemo. We're going to remove a mass or two. I didn't expect the girls have got to go. So I'm crying, and I see them walk out of the clinic in tears. I know what she had been told. And it broke my heart. And I thought, okay, I am a nurse. I'm a trauma therapist. I'm a life coach specializing in trauma therapy. I'm going to use my journey to help other people. I am going to get through this. I have to get through this. And I called Gary, and I cried, and he listened to me cry. And I called my other best friend, Gary, and he listened to me cry. And I had a good support team that listened to me cry when I needed to. That wasn't a lot. You just kind of do what you have to do to get through it. You have it in you. I remember telling Gary Morris, the second Gary. He was an attorney that was one of my dearest friends on this planet. He died a couple of years ago. And I remember telling him, he came over and brought me some flowers, as he always did. And I said, I don't know if I can do this. And he said, you can do anything. Look at everything you've survived. This is nothing. This is nothing. This is an inconvenience in your life. This is a blip on the radar. This is nothing compared to other things you have survived. You've got this. Because we're all going to see that you have it. You're going to be fine. And I was. Allow your friends to love you. Allow them to lift you up. Allow them to be there for you. And in game, use your journey to light the path for others. It was probably 3 months after surgery, I got a call from Patty, Dr. Patty. And she said that she had 2 sisters that were young, college age, that their mom had recently died of breast cancer, and they are BRCA positive or BRCA positive. They have the gene. And it was advised that they get, they go ahead and have the double mastectomies because the odds of them getting this type of cancer was so great. And she said, would you talk to them? Absolutely, because of course they're afraid. She said, we have one obstacle. And I said, what's that? And she said, it's their father. Because their father told them, you're no daughter of mine if you're not woman enough to go through cancer, if you're going to take the easy way out. That fired me up. Oh, honey, I'll talk to him. You bet your ass I'll talk to them. And I did. And I talked to him. You can imagine how that conversation went. His wife's cancer journey was her journey. His daughters were young. They were college students. They have the rest of their lives ahead of them. Give them the best chance for having a successful life. Don't say, no, you deserve to have cancer. No one deserves to have cancer. No one. I have fought it more than once and beat it. I pray to God I am never diagnosed with it again, because I don't want to go through that again. Nobody does. I'll cross that bridge when I come to it if it happens. I don't foresee it happening. I take very good care of myself. I eat well for the most part. I mean, every once in a while you got to have a bacon cheeseburger, you know. But I do eat very healthy. I take care of myself. I work every day. I do tons and tons of meditation and prayer and help as many people as I can along the way. Please share this with others. It may help somebody, it may not, but it was my cancer journey. I made it. I did just fine. People look at me and they would never know, you know, that I had breast cancer. Once you make it through, nobody's going to know unless you want to share your journey, unless you want to share the story, unless you want to light the path for others like I do. It's up to you. But please, self-care. Get a mammogram. Get checked. You're worthy.